After a concussion, most people look like they've recovered very well, very quickly. They may not show their difficulties. They may not even have cuts and bruises. What I've found is that a lot of people don't want to talk about it or don't even think to mention it to their families, friends, their coworkers, or their doctors or therapists, because they're like, you know what, this isn't a big deal. I've had a headache in the past, or, maybe I'm just a little bit, out of it. And so I'm not thinking perfectly, but I don't want to bother someone about that. Or this is a weird thing and I don't really want to talk about it. I'm just going to man up. All right, I'm going to get well. I'm going to get back on the field or get back with my platoon. And I'm just going to do my job. And I understand that. And that's really common. And I'm sort of like that too. I don't like to kind of talk about my problems. But in this case, these are important things to bring out. One, because that's how we can get you well. That's how we can provide help, because all of these difficulties that you're having after a concussion or mild traumatic brain injury or more severe injury, all of them have treatments that are very effective. Always ask someone around you, a trusted friend, or hopefully a therapist or clinician, I've got this difficulty, I haven't talked about it yet. What can I do to help it? Don't self-medicate. Don't treat yourself, even though it may seem commonsensical, because this organ in between your ears is the most important one you got. And we don't like to make slip-ups or kind of make assumptions. You're probably right. You probably do know what's best for yourself. You've treated yourself in the past. You may have had even concussions in the past. But let's assume that maybe there are some things that we could help you with even more. So number one, make sure you let folks know when you're having difficulties or that you've had difficulties so we can help you. Make sure you're working with a healthcare professional that you trust and you're telling him or her this difficulties you're having. And then when they teach you things, they give you information or they help you, do those things. Don't just say that's interesting and put it on the shelf. Do the exercises, do the behavioral strategies, the therapy, do the deep breathing, do the stretching of your neck, whatever. Right? And the most important reason is, even if you think you're Superman or Superwoman and you don't think you're going to have a problem, other people rely on you. Whether it's the guy or gal on your team, the person that you're going into combat with, the person who you're driving in your car, your kid in the back seat, those people rely on you performing at a high level and really doing your role, your job, whatever it is you're doing it well and doing it efficiently. And you may think you're doing it perfectly, but after a concussion, some of these subtle problems can actually cause significant difficulties with your doing even everyday things. So it's okay to have difficulties. Let folks know, follow through with what they say, and believe you're going to do well and you're going to recover. But it's a journey and it's a process, and let folks help you with that.